Family Assessment Project by Sarah Lovis. This family assessment was conducted using Freeman's Family Assessment Model. This model utilizes structural, functional, developmental, and systems theory to evaluate families as subsystems within society. It allows nurses to assess both the family unit and its relationship with broader social institutions. The model examines 6 specific areas: identification data, family developmental stage and history, environment, structure, functions, stress and coping. Identifying data. This family assessment was conducted on the Lovertons. This family resides in St. Tammany Parish of Louisiana. It would be considered a nuclear family type as it includes a father, mother, and 2 daughters. This family's cultural background would be, their ethnicity would be considered Caucasian. They are English speaking, and the parents and children have all been born and raised in the United States. The family's culture is manifested through its food choices. The family's religious identification is Catholic. Both the mother and father were born and raised in the Catholic Church and attended Catholic school from elementary to high school. This family does struggle to get to church every Sunday, but does perform prayers at home. The Catholic faith is important in this family, and the Lovertons do plan for their children to attend Catholic school. This family would be considered upper middle class. Both the mother and father are college graduates and have administrative positions at their companies. Their family income would be considered adequate, as well as they are able to meet all of their household needs and as well as savings. This is the genogram for the Loverton family. To the left, we start with Anna and Mickey, who are the parents of Donald and Devin. And to the right, you have Ashley and Kent, who are the parents of Sally. Together, Devin and Sally then had Ella and Abby, and that is who makes up the Loverton family. This is the eco map for the Loverton family. They have strong relationships with the children's school, their faith, and their extended family. Complex relationships with finances, careers, and family vacations. The developmental stage and history of the Lovertons. The developmental stage they are currently in, based on Duvall's family development model, would be the families with preschool children. And this family is fulfilling the developmental tasks as they are going through the growth and development of their children. They're adapting to multiple children, as now they have a 4-year-old and 1-year-old. And with that, they are dealing with the low energy of having 2 small children with demanding careers. The parents also try to prioritize their own relationship and maintain intimacy and a strong bond by having date nights with their family as sitters. The family history of the Loverton is relatively uneventful. They have not really experienced any significant divorces or deaths amongst their immediate family. Both the parents had grew up on the south shore of Lake Pontchartrain, living near each other as children. They both were raised in traditional homes and have good, strong relationships with their parents. Environmental data. The family lives in a single-family 4-bedroom home. This home is owned by the family. The home is in good condition as it was built in 2017 and they were the first home owners. This home does meet the family's needs, as everyone has a bedroom and has space for storage of their belongings. There are some safety hazards in their neighborhood, as it is a very busy neighborhood with lots of cars moving around. They do try to make sure that they are protected within their home, as they have adequate smoke detectors, an alarm system, and child protection locks on the doors. They do live in a larger community, and it is still in the developmental stages. This community, though, is located near the children's school as well as doctor's offices and grocery stores. It is very accessible. The family's geographical mobility, they have lived in this home together as a family, and the parents had lived in the home 4 years prior. At this time, there is no potential of the family moving, but could always be a possibility with the husband's job, as it is in oil and gas, which at times requires a move out of state. The family's association and transactions with community, they're not typically using any community services or groups at this time. Both children do attend a nursery school, and so they do have support there as well as with their extended family. And on the eco map, we did go through that they have a strong relationship with their children's school and extended family. Their extended family is the support that they need when experiencing difficult times. Family functions. This family's definition of health is that everyone remains out of the hospital and safe at home. This is defined by being that the mother is a nurse and has lots of medical knowledge and a good healthcare sense. This family would be considered healthy. As far as dietary practices, they do try to make healthy choices, but being that they are very busy, sometimes it is a diet of convenience. Sleep is a priority, but sometimes difficult with 2 small children. The family tries to incorporate physical activity as often as possible and utilize their community parks. The family's self-care practices are those that are recommended by their primary care providers. They utilize all recommended appointments for their age ranges for the small children, and both parents maintain annual checkups as needed. The source of payment for the health insurance, it is covered by the father's employer, and it is logistically very easy for them to receive care, as the doctor's offices are very conveniently located to their home. Family stressors and coping adaptation. This family, as far as short-term stressors, would be nursery illness. The 2 small children are often sick with colds due to the frequent exposure of germs at the nursery. Thankfully, they have not had any severe illnesses that required hospitalization. A long-term stressor that this family faces is the demanding careers of both parents, and it is difficult to make sure that the children remain a priority. This family does have strengths that counterbalance these stressors, and that is that they have a strong bond and lots of family support. The internal coping strategies that this family uses is family group reliance and joint problem solving. The external coping strategies used are family support. Fortunately, this family does not experience any dysfunctional coping strategies. The nursing diagnosis that applied to this family is risk for impaired parenting related to stress and fatigue from balancing work, parenting, and household responsibilities. The interventions would be parenting education, offering resources or referrals to parenting classes that focus on managing stress and using positive reinforcement with children. Self-care technique, Educating the parents on the importance of self-care, stress management, and how to take time for themselves can positively affect the ability to parent effectively. Family routines, helping the family develop structured routines that ensure both parents and children have time for essential activities, including rest, meals, and quality interaction. And delegation of tasks. Encourage the parents to delegate or share household duties to reduce individual stress and prevent burnout. The goal for this family is the family will enhance social interaction by spending more quality time together and minimizing work-related stress. The Healthy People 2030 objective that applied to this family is increase the proportion of children and adolescents who communicate positively with their parents. Communication between parents and children can involve discussing beliefs, experiences, and feelings. Such communication is considered important for relationships and may influence the children's health outcomes and academic performance. Parenting and family interventions can be used to increase communication between parents and children, including those with behavioral disorders. This slide includes the references that were used in this presentation. Thank you.